As a heart surgeon with more than 30 years of experience, I've seen thousands of patients over the age of 60 come into my office, worried about chest pain, shortness of breath, or sudden fatigue. But many times, the real problem wasn't their diet, and it wasn't their lifestyle. It was a medication they had been taking every single day. Some of the most common pills used by seniors today can slowly weaken the heart, raise blood pressure, or trigger dangerous rhythm problems. And many people never realize it. The effects don't always appear immediately. Sometimes it takes years before the damage becomes noticeable. In today's video, I will reveal 7 common pills that may quietly harm your heart after 60. This video is not meant to scare you. It is meant to help you stay informed. And please remember, never stop any medication without speaking to your doctor first. But understanding the risks could protect your heart and possibly even save your life. Make sure you watch until the end, because pill number 1 is the most commonly used and the most surprising. Let's begin. Pill number 7. The common painkiller millions take every day. Number 7 on the list is non-steroidal anti-inflammatory drugs, also known as NSAIDs. These include medications like ibuprofen and naproxen. They are often used for arthritis, joint pain, and back pain, conditions that become very common as we age. Because these medications are available over the counter, many seniors assume they are completely safe. But here is the problem. These drugs can raise blood pressure and cause fluid retention, which forces your heart to work harder. For an aging heart, that extra strain can become dangerous. Over time, frequent use of NSAIDs can also damage blood vessels and reduce kidney function. And when the kidneys struggle, your cardiovascular system suffers as well. Many seniors take these pills every day without realizing that they may be increasing their risk of heart problems. This doesn't mean they are always unsafe, but taking them regularly without medical supervision can quietly put stress on your heart. If you need pain relief often, it's important to speak with your doctor about safer long-term options. Pain relief should never come at the cost of heart health. Pill number 6. The diabetes pill that may overload the heart. Next on the list is a group of medications used to treat type 2 diabetes. These are called thiazolidinediones, including drugs like pioglitazone. These medications help control blood sugar levels, which is important for preventing complications from diabetes. However, they can also cause the body to retain fluid. This often leads to swelling in the legs and ankles. But the bigger concern is what happens inside the body. Extra fluid forces the heart to pump harder. And over time, this can contribute to congestive heart failure, especially in older adults. Many seniors with diabetes already have a higher risk of heart disease. When a medication increases fluid retention, it can quietly push the heart beyond what it can comfortably handle. Another issue is that symptoms of heart strain, like fatigue or shortness of breath, can be mistaken for normal aging. Because of this, the warning signs may be missed. If you are taking medication for diabetes, it's important to discuss with your doctor whether the treatment is still the best option for your heart health. Managing blood sugar is critical, but protecting your heart is just as important. Pill number 5. The sleep pill that can affect heart rhythm. Many people over the age of 60 struggle with sleep, and because of this, millions rely on sleeping medications. Drugs such as Zolpidem or older sedatives like diazepam are often prescribed to help people fall asleep faster. At first glance, these medications may seem harmless, but they work by slowing down the central nervous system. This affects not only your brain, but also your breathing and heart rate. Over time, these medications can worsen sleep apnea, a condition where breathing repeatedly stops during sleep. Every time breathing stops, oxygen levels drop, and that forces the heart to work harder. Repeated episodes like this can increase the risk of irregular heart rhythms and cardiovascular stress. Sleep medications can also interact with other drugs commonly prescribed for seniors, including heart medications. This combination may increase the risk of dizziness, confusion, and falls. Better sleep is important, but long-term dependence on sedatives can sometimes create new health risks. That's why many doctors now recommend exploring safer sleep strategies whenever possible. Pill number 4, the older antidepressant that can disrupt your heartbeat. Number 4 on the list is a group of medications called tricyclic antidepressants. These drugs were widely prescribed years ago for depression, anxiety, and sometimes even chronic pain. Common examples include amitriptyline and nortriptyline. While these medications can still be effective for certain patients, they come with important risks for older adults. Tricyclic antidepressants can affect the electrical system of the heart, which controls how your heart beats. This may lead to irregular heart rhythms, sudden drops in blood pressure, or a condition known as heart block, where the electrical signals in the heart slow down or stop temporarily. For seniors whose heart rhythm may already be sensitive, this can become dangerous. Another issue is that these medications can cause dizziness and confusion, especially when standing up quickly. This greatly increases the risk of falls and injuries, which can lead to serious complications in older adults. Today, there are newer antidepressant medications that are often considered safer for the heart. But some people are still taking these older drugs for many years without realizing the potential risks. If you are taking one of these medications and experience symptoms like dizziness, unusual fatigue, or heart palpitations, it is important to discuss it with your doctor. Sometimes, a small change in treatment can make a big difference for your heart health. Quick, important message. Before we move to pill number 3, there's something very important I want to mention. If you are over 60 and taking several medications, keeping track of them can become very difficult. Many seniors experience side effects simply because medications interact with each other. That's why tools that help track symptoms, medications, and daily health changes can be extremely helpful. Being aware of small changes early can sometimes prevent serious health problems later. Now, let's continue with pill number 3. Pill number 3. The cold medicine that raises blood pressure. Number 3 on the list may surprise many people. These are decongestants, medications commonly used for colds, allergies, and sinus congestion. Two common ingredients are pseudoephedrine and phenylephrine. These medications work by narrowing blood vessels in the nose to reduce swelling and congestion. But the problem is that they don't only affect the nose. They also narrow blood vessels throughout the entire body. This causes blood pressure to rise and forces the heart to pump harder. For younger people, this may not be a major issue. But for someone over 60, especially with high blood pressure or heart disease, this extra strain can become dangerous. Some seniors experience rapid heartbeat, anxiety, dizziness, or heart palpitations after taking these medications. And many people assume they are safe simply because they are sold without a prescription. But age changes how your body processes medication. What felt harmless in your 40s may place real stress on your heart later in life. Always read medication labels carefully and speak with your doctor before using decongestants if you have heart or blood pressure concerns. Pill number 2. The heartburn medication linked to long-term heart risks. Number 2 is something millions of seniors take every single day. These are proton pump inhibitors, often called PPIs. Examples include omeprazole and pantoprazole. These medications are commonly used to treat acid reflux and heartburn. They work by reducing stomach acid, which helps relieve burning discomfort in the chest. However, stomach acid also plays an important role in helping the body absorb certain nutrients. One of the most important of these is magnesium. Low magnesium levels can lead to irregular heart rhythms, muscle weakness, and fatigue. Long-term use of these medications may also affect the balance of bacteria in the gut, which can contribute to inflammation. And chronic inflammation has been closely linked to heart disease. For short periods, these medications can be very helpful. But taking them continuously for months or even years without reassessment may not always be necessary. If you rely on heartburn medication daily, it may be worth discussing other options with your doctor. Sometimes, small changes in diet or lifestyle can reduce the need for long-term medication. Your digestive comfort is important, but your heart health is even more important. Pill number 1. The blood pressure medication that can slow the heart too much. And now we come to number 1. One of the most commonly prescribed heart medications for seniors, calcium channel blockers. These medications are often used to treat high blood pressure, chest pain, and certain heart rhythm conditions. Some well-known examples include verapamil and diltiazem. These drugs work by relaxing blood vessels, which helps lower blood pressure. But they also slow down the electrical signals in the heart. In some seniors, this effect can become too strong. The heart rate may slow down more than intended, leading to symptoms such as dizziness, fatigue, shortness of breath, or even fainting. Another common side effect is swelling in the legs and ankles, which may signal that the heart is struggling to pump efficiently. These medications can also interact with other drugs that many seniors take, increasing the risk of complications. The key issue is not that these medications are always unsafe. In many cases, they are very helpful. The problem occurs when they are used without careful monitoring, or when side effects are mistaken for normal aging. If you are taking this type of medication and notice unusual tiredness, swelling, or a slow pulse, it is important to speak with your doctor. Sometimes, adjusting the dose or switching to a different medication can greatly improve how you feel. Final message. Очень важная часть удержания. If you are over the age of 60 and taking medications, the goal is not to feel afraid. The goal is to stay informed. Every medication we discussed today was originally created to help people. But when medications are taken for many years without review, side effects can slowly appear. As a heart specialist, I have seen many patients whose heart problems were not caused by disease, but by medications that quietly affected their body over time. The good news is that many of these risks can be reduced simply by asking questions and reviewing your medications with your doctor. Never stop a medication on your own. But never ignore warning signs from your body either. Your heart works for you every second of every day, and protecting it should always be a priority. If you found this video helpful, share it with someone you care about, and subscribe for more health insights designed especially for adults over 60. Take care of your heart, because it takes care of you.